Hey there, and welcome. If you've got an exam on vital signs coming up, then you are in exactly the right spot. This is your high-speed, focused study guide, and it's designed to help you completely master the core concepts.
We're going to cut right through all the noise and focus only on the most critical, most testable information you need to know. Seriously, no fluff, just the stuff that's going to get you those points. Okay, you ready? Let's dive in.
So here's our game plan. We'll start with the why. Then we'll move through each key measurement: height, weight, temperature, pulse, respirations, and blood pressure. Then we'll finish up with a super quick review of the numbers you absolutely have to memorize. Think of it as a roadmap to success.
All right, first up, the fundamentals. Understanding why we take vital signs is really the foundation for everything else, and trust me, examiners love to ask about these core principles. Think of it this way. Vitals tell a four-part story. They tell us how the body's main engines, the vital organs, are running. They act as an early warning system for any problems. They show us if our treatments are actually working, and they give us that all-important baseline to see how things change over time. You should definitely expect to see these concepts pop up in your multiple-choice questions.
Next up, let's cover height and weight. Now I know they might seem kind of basic, right? But accuracy here is absolutely critical, especially when it comes to calculating medication dosages. That's a major safety point, and for sure, a guaranteed test topic. For your exam, you'll need to know the correct procedure. As you can see, the key differences are pretty clear. For a standing client, it's all about proper posture and using that height rod correctly. But for a client in bed, it's about getting them perfectly flat and then marking the sheet at the absolute top of the head and the very bottom of the heels.
So here's the big takeaway for accurate weight. It's not about a single measurement, it's all about consistency. For your exam, remember these 4 rules for reliable tracking. Same scale, same time of day, same amount of clothing, and always zero out the scale first.
All right, on to our first true vital sign: temperature. Pay close attention here, because the different sites and their normal ranges are high-yield topics for any exam.
Okay, this table is pure gold for your test. You've got to memorize it. The most common exam trick is to mix these up, but just remember 2 simple rules. Rectal is typically the highest or warmest reading, and axillary, under the arm, is typically the lowest or coolest. Just knowing that one distinction can help you eliminate wrong answers right away. And this quote right here perfectly captures the trade-off. It's a simple summary of what you need to know about the axillary site. An examiner might ask, which temperature site is considered the least accurate? And bam, you know the answer. It's safe, sure, but it's just not the most precise. Now here's a clinical reasoning question you might see. Why is a 37.5-degree temperature more concerning in an 80-year-old than a 20-year-old? Well, it's because their baseline is naturally lower, thanks to a slower metabolism and less of that insulating fat and muscle. So even a slight fever can be a huge red flag for a serious infection.
Okay, let's bundle these next 3 together. They are all super closely related, telling us the story of how the body is circulating and using oxygen. We'll start with the heart, then move to the lungs. The pulse oximeter is a magical little device that gives you 2 vitals for the price of 1. It tells you the pulse rate, of course, but it also gives you the SpO2, which is just the percentage of oxygen in the blood, a really vital piece of data.
When it comes to procedure, you've got to remember this common test question. What interferes with a pulse oximeter reading? And the number 1 answer they're looking for is nail polish. Also, you have to make sure the finger is warm and the person is still to get that accurate, steady number.
This is a number you just have to know. The normal oxygen saturation, or SpO2, for a healthy person is between 95 and 100%. It's that simple. Go ahead and lock it in.
When you're assessing respirations, it's not just about the number. A full assessment actually has 3 parts. As you can see, you need to check 3 things. Is the breathing effortless? Is the rhythm regular? And finally, is the rate within that critical adult range of 12 to 20 breaths per minute? All 3 have to be true for it to be considered normal.
Now for the big one, blood pressure. This can feel a little complex with all its variables, but don't worry, we're going to break it down into simple, testable concepts.
You know, test questions love to give you a scenario. A client just ran up the stairs. What do you expect their blood pressure to be? Or a client is in severe pain. This slide lists the most common factors. Knowing these will help you analyze those scenarios correctly. A key one to remember is white coat hypertension. That's just anxiety in a medical setting causing a higher reading.
Okay, if you memorize one thing from this section, make it this slide. A cuff that's too small requires more pressure to cut off blood flow, giving you a falsely high reading, and a cuff that's too large, well, it's too loose, giving you a falsely low reading. Just remember, small cuff, high number, large cuff, low number. This is so crucial. So, this slide gives you the full checklist for an accurate and safe measurement. Think of these as the absolute rules. Let the client rest, use the right cuff on a bare arm, position that arm at heart level, and always, for safety, avoid an arm that has an IV or any kind of injury.
We're in the home stretch. This is our final rapid-fire review. Let's lock in the numbers you absolutely must know to walk into your exam with total confidence. You know, the key insight on this slide is the trend. Look at how pulse and respiration start very high in infants and then gradually slow down as a person gets older. Understanding this overall pattern is way more important than memorizing every single number for every age group, but you better be rock solid on that adult column.
Okay, let's put it all together. These 4 ranges for a healthy adult are your must-knows. They will absolutely be on your exam. Pulse, 60 to 100. Respirations, 12 to 20. Blood pressure, less than 120/80. And SpO2, 95 to 100%. Go ahead and commit this slide to memory.
And we'll end with this. Memorizing the numbers is step 1. The real mastery comes from applying it. So think about it. In cases of infection, shock, or respiratory distress, which of these numbers go up and which go down? That's the next level of understanding. You've got the foundation, now go ace that exam.